vertebrae, Quadratus Lumborum. This muscle comes from the top of the iliac bone, and then it attaches to the lower edge of the rib cage, the lower rib. It also has strands that come across and attach to the transverse processes of the vertebrae. So some of the fibers are going this way, some of the fibers are going this way. And they all attach here to the upper end of the iliac bone. To get into place, ground with your grounding hand first, and then the active hand slides across with my hand relaxed and with my hand touching her. What we want to avoid doing is just coming in like this, where you cock your wrist and come in like a sledgehammer erase. Instead, we want to slide in like an airplane landing, or the Canadian geese that are landing on the water. Shh, over and across. And my support hand, my active hand slides across, and right now this elbow is right at the top of her iliac bone. I want to catch that tissue, and then I'm going to pull it this way or this way. I'll do some of them this way, some of them this way. So glutes here, heads up there, catch that tissue, catch it, and stretch it. When I catch it, my hips go back. It's right here. There's a catch and my hips are back. I've got a good catch, and then my hips push forward. Catch it, and that move comes from the hips. And watch the difference if I don't use my hips. This is all using my shoulder, and I don't get a good catch, and it's painful and or at least uncomfortable on the shoulder. So catch, and then the move comes from the lower body, like that. Notice also my hand here, the wrist is relaxed. Do not put your hand up like this, because I immediately get tension in my shoulder when I do that. So I keep my hand down, possibly curled like that. And then some of my stretches are going this direction, some are going this direction. Catch it. And this piece where I catch, I can feel my abs engage. Right here where I say catch, the whole belly comes in. Catch, and that comes in there. In position, catch, and then catch that tissue and stretch it. I'll do a couple from the other side here. Ground, active hand grounds, slide across. Move my body to find the good position. Catch, my belly comes in right there, and then stretch. Catch it, and stretch it. Now that QL muscle that we're targeting is deep. It's under a lot of other muscles. So I need to catch and go through all those layers of muscles. The QL muscle is the deepest muscle on the back side of the body. It's bed buddies with the psoas muscle. Psoas is the deepest on the front side of the body. So they touch each other. Come out and soothe. You can do that stroke either first, in the middle, or at the end. At the beginning of the treatment, somewhere in the middle of the treatment, or after you finish the legs, you can go back and do that.